Platelet-Rich Plasma PRP versus Platelet-Rich Fibrin PRF for hair loss. Which is better? There's lots of hype about PRF and often people even charge more for PRF. But does the yield weigh up? Is it worth the extra cost and the extra pain caused when injecting? Well, in today's video, I am going to give you 3 key differences between these 2 treatments head to head. And I'll give you some good insights into why you may select one or the other, or in some instances, you may select both. So if you're treating androgenic alopecia, this video is for you. If we haven't already connected, I'm Dr. Jonathan Hopkirk, Sydney-based hair loss doctor and co-founder of Levels of You, an Australian-based hair restoration company where we treat patients across Australia on a daily basis. But I'm also someone that is in your position. I am you. I have androgenic alopecia. I've struggled and gone through the ins and the outs, the highs and the lows of a 10-year treatment journey, and I've had the pros and the cons. I've had side effects. I've had post-finasteride syndrome. I've had PRP. I've had SMP. I've had so many different treatments over the years that have either led to good results or poor results and side effects. So I love nothing more but to give you key insights so you can have a better chance of success and a lower chance of side effects. So as I said, in today's video, I'm going to give you 3 key differences between PRP and PRF. If you're not familiar with these treatments, well, you're actually going to learn in the first key difference what these treatments are. So let's jump right into it. So key difference number 1 is what's in the tube. So if you're not familiar with these treatments, as I just said, essentially what happens is they draw a sample of your blood and they spin it in a centrifuge. So in little test tubes, they spin it in a centrifuge, and what they're trying to get is they're trying to get certain constituents of your blood, the certain elements from your blood that will give you potential benefits to your scalp for hair growth, increasing density and thickness when injected with a needle. Now, the difference is what's in the tube. With platelet-rich plasma, what they're doing is the spinning in the tube, they're mixing the blood in the tube with an anticoagulant, which separates the platelets off from the rest of the blood. And so what you get at the end is a nice serous fluid that has got platelets in it. And in the platelets, you have growth factors, which can bring benefits to your hair follicles. Now, these platelets, when injected into the scalp, will give a short burst of growth factors in the areas that they've been injected. When you compare that to PRF, platelet-rich fibrin, well, this is spun in a test tube, or a number of test tubes, depending on how big the sample is, spun in the centrifuge at lower speeds, and it's spun without an anticoagulant, so it's a more viscous fluid, and it creates this fibrin matrix. Now, this fibrin matrix is like a scaffold, so when you inject it, it can attract platelets and leukocytes, and it's sticky. So actually what you get in the area of injecting is a slower release of these growth factors over a period of time in the area that you've injected it in. So that's key difference number 1, is what's in the tube. Key difference number 2 is the preparation and handling. So how is this actually administered into the scalp? Now, PRP is often spun twice at higher forces. As I was saying earlier, it's spun at a quicker speed than with PRF, and it's a more serous fluid, and it's easier to inject. So you can often inject it with slightly smaller needles than you can with PRF. Can also be combined with other activators, so sometimes people inject them with things like exosomes, other peptides. And because it's a serous fluid type material, you can often inject it across the scalp and get good coverage of the scalp. Compare that to PRF, however, while it's spun at lower forces, at a lower speed, it is not with an anticoagulant, as I said, so it's a thicker serum, it's more viscous, and so injecting it into the scalp is much harder. So you often have to inject it out of larger gauge needles, so needles which are thicker. Obviously that leads to the fact that you'll need a better anesthetic because it's likely to be more painful. But also because it's sticky and you don't have an anticoagulant in it, you need to inject it quicker. So you've got a shorter space of time in which you can inject the scalp before it clots. So what you need to do is you need to target those areas that you're particularly concerned with sooner. It often means that there's less time for the professional to administer it into the scalp. And so you don't tend to get as good a coverage of the entire scalp when injecting. So that's number 2, the preparation and handling of the 2. Number 3 is evidence and expectations. Now, there is, if you tuned into my video a few weeks back, there is about 10 randomized controlled trials comparing PRP to either placebo or other key hair loss treatments or medications on the market. However, when it comes to PRF, there is less evidence behind PRF. It is a relatively newer treatment for hair loss. There is only one head-to-head study of PRF versus PRP. It didn't show that PRF was considerably better than PRP. In fact, it might have been even slightly inferior. But if you look at the two head-to-head in this study, even though it was one study and it was a relatively small study, it didn't show that it was a huge statistical significance. And there especially was not the benefit from PRF to warrant anyone charging you more for this particular treatment. So the difficulty with both of these treatments, however, is there is a bunch of different companies that sell the tubes that actually lead to you being able to create either PRP or PRF, and there's no one standardized protocol. So if you've got PRP up the road or PRF, even in the same joint sometimes, in the same place sometimes, you're going to get variations in the outcome. So in the way that they spin the blood, what is in the tube that they spin the blood with, and then the way that the person injects it. If it's freehand, then you're going to get a different result every time you see the person, versus if it's with the device that injects it in a methodical way. So the evidence is still lacking on a grand scale with PRF. With PRP, it's slightly better, but still only 10 randomized controlled trials. Looking at PRP for androgenic alopecia is relatively limited in my view. But what separates these two, at least on the third metric, is the evidence and the expectations. So the expectations would be, if you had PRP, well, you know you're going to have more coverage of the scalp, and you're going to be having the best chance of success if you've got mild to moderate hair loss. Whereas if you're using PRF, you're not going to be able to cover the entire scalp necessarily, and you're likely going to have a slower release of those growth factors, but still, it's going to be something that you want to use if you're in mild to moderate stages of hair loss. And in most cases, you're actually going to get a better result if you have both, because the platelet-rich fibrin can make those platelets sticky. And so you can have both a short burst of those growth factors, and then you can have a bit of a sustained release of the growth factors as well. I hope today's video was of benefit. If you want to get your hands on our Medical Board's free hair loss ebook sent directly to your inbox, or you want to get $300 off this Grow Laser Cap that I've used myself for the last 16 months, simply email me at jonathan@levelsofyou.com and I'll send it over to you ASAP. Next week, I'm jumping back into the PP405 debate. Now, there has been some scams online with companies releasing PP405, and the internet has gone bonkers. People are saying that they've had results. They've been talking to buddies that have had the treatment, and this thing is the next best thing. Do not be fooled. I will be talking about this to you next week. Hope you have a good week. Look after yourself. See you next week. Cheers.